Okay, let's try this again. Today is November the 24th, Wednesday. Since the last time we were together, which was last Friday, we have lost an additional 92 people in West Virginia. I ask that you give them all the respect and all the honor as I read through these people and their age and gender and the county in which we lost them. And again, I ask that you, especially at this time of year, can you just imagine how difficult this is on all these loved ones of these great people? The 4,726th death is a 65-year-old male from Logan County. The 4,727th death is a 75-year-old male from Upshur County. The 4,728th death, a 48-year-old female from Wood County. The 4,729th death, a 78-year-old female from Barber County. The 4,730th death, a 67-year-old female from Harrison County. The 4,731st death, a 57-year-old male from Cabell County. The 4,732nd death, a 65-year-old female from Jackson County. The 4,733rd death, a 71-year-old female from Preston County. The 4,734th death, a 91-year-old female from Jefferson County. The 4,735th death, a 95-year-old male from Marion County. The 4,736th death, a 97-year-old male from Summers County. The 4,737th death, a 76-year-old male from Cabell County. The 4,738th death, a 94-year-old female from Mineral County. The 4,739th death, a 57-year-old female from Greenbrier County. The 4,740th death, a 70-year-old male from Wood County. The 4,741st death, a 63-year-old male from Harrison County. The 4,742nd death, a 65-year-old female from Berkeley County. The 4,743rd death, a 65-year-old male from Cabell County. The 4,744th death, a 64-year-old male from Boone County. The 4,745th death, a 73-year-old male from Randolph County. The 4,746th death, a 68-year-old male from Roane County. The 4,747th death, a 65-year-old male from Harrison County. The 4,748th death, a 102-year-old female from Wood County. What an incredible life. We lost an awful lot of wisdom, that's for sure. The 4,749th death, the 4,749th death, an 84-year-old female from Taylor County. The 4,750th death, a 77-year-old male from Raleigh County. The 4,751st death, an 86-year-old male from Jackson County. The 4,752nd death, a 79-year-old male from Marion County. The 4,753rd death, a 59-year-old male from Kanawha County. The 4,754th death, a 69-year-old male from Nicholas County. The 4,755th death, a 73-year-old female from Randolph County. The 4,756th death, a 43-year-old male or female from Harrison County. We'll do that again. The 4,756th death, a 43-year-old female from Harrison County. The 4,757th death, a 53-year-old male from Harrison County. The 4,747th death, a 47-year-old male from Logan County. The 4,759th death is a 52-year-old male from Wayne County. The 4,760th death, an 87-year-old male from Logan County. The 4,761st death, an 86-year-old female from Calhoun County. The 4,762nd death, a 99-year-old female from Tucker County. The 4,763rd death, a 79-year-old female from Fayette County. The 4,764th death, a 47-year-old female from Brooke County. The 4,765th death, a 60-year-old female from Harrison County. The 4,766th death, a 65-year-old male from Upshur County. The 4,767th death, a 60-year-old male from Nicholas County. The The 4,768th death of a 73-year-old male from Marion County. The 4,769th death of a 73-year-old female from Wetzel County. The 4,770th death of an 85-year-old male from Marshall County. The 4,771st death is a 72-year-old female from Hancock County. The 4,772nd death of a 75-year-old female from Harrison County. The 4,773rd death of a 64-year-old female from Harrison County. The 4,774th death of a 72-year-old male from Kanawha County. The 4,775th death of an 89-year-old female from Lincoln County. The 4,776th death, a 65-year-old female from Harrison County. The 4,777th death of an 82-year-old female from Kanawha County. The 4,778th death of an 87-year-old female from Kanawha County. The 4,779th death of a 92-year-old male from Kanawha County. The 4,780th death of a 66-year-old male from Mercer County. The 4,781st death of a 79-year-old female from Nicholas County. The 4,782nd death of a 62-year-old male from Berkeley County. The 4,783rd death of a 64-year-old male from Kanawha County. The 4,784th death of a 58-year-old male from Mineral County. The 4,785th death of a 68-year-old male from Pocahontas County. The 4,786th death of a 78-year-old female from Braxton County. The 4,787th death a 73-year-old female from Marion County. The 4,788th death of a 58-year-old male from Grant County. The 4,789th death of a 77-year-old male from Berkeley County. The 4,790th death of a 77-year-old female from Wayne County. The 4,791st death of a 65-year-old male from Wood County. The 4,792nd death of a 92-year-old female from Putnam County. The 4,793rd death of an 85-year-old female from Preston County. The 4,794th death of a 90-year-old female from Mercer County. The 4,795th death of a 95-year-old male from Taylor County. The 4,796th death of a 61-year-old male from Putnam County. The 4,797th death of an 86-year-old female from McDowell County. The 4,798th death of a 65-year-old female from Nicholas County. The 4,799th death of a 72-year-old male from Clay County. The 4,800th death in West Virginia is a 74-year-old male from Kanawha County. The 4,801st death of a 55-year-old female from Mineral County. The 4,802nd death, a 62-year-old male from Brooke County. The 4,803rd death, a 63-year-old male from Marshall County. The 4,804th death, an 80-year-old male from Wetzel County. The 4,805th death, an 81-year-old male from Marion County. The 4,806th death, a 73-year-old male from Greenbrier County. The 4,807th death, a 95-year-old female from Kanawha County. The 4,808th death, an 85-year-old female from Boone County. The 4,809th death, a 38-year-old female from Kanawha County. The 4,810th death, a 60-year-old male from Putnam County. The 4,811th death, a 68-year-old female from Logan County. The 4,812th death, a 95-year-old male from Jackson County. The 4,813th death, a 77-year-old female from Raleigh County. The 4,814th death, a 51-year-old male from Greenbrier County. The 4,815th death, a 49-year-old female from Wetzel County. The 4,816th death, a 72-year-old female from Greenbrier County. The 4,817th death in West Virginia is a 72-year-old male from Wood County. My. Like I said, we've lost 92 more people. The only way in the world we're going to stop this, and I know you're sick and tired of hearing me say this, the only way on this planet that we're going to stop this that we know of today is to get vaccinated. It's the only way. You surely to goodness above can't think this is tolerable. I don't know how in the world you could put up in any way with reading 92 names. Like I said before, and I happened to walk in the house, and it just so happened that CNN was on. And Kathy said, "You're on the TV." And I looked, and, there it was, one of our briefings. And, and basically what it was saying was, I was saying, we're not through this. I was repeating the General Hoyer. I was also saying that there could be another surge on the way because the numbers you can make an argument that really and truly the fifth surge could very well be on the way. And I was making an argument really about how cold it was going to get and what the likelihood of even more numbers increasing. But what I said, I was trying to say that was the most profound thing that I was trying to say was just this. Surely we can't put up with this. Surely we just can't sit back and say this is going to be the new normal. The new normal is every other day, Justice is going to sit down there and read from 20 to 110 names. Every other day. And we're going to just sit by and say, well, that's okay. Well, it's not okay. It's really not. And we just got to do something about it. And the only thing we can do is just keep encouraging people to get vaccinated. The active cases are 6,754. The new positive cases are in the last 24 hours, I guess, are 883. The daily positivity rate is at 7.53. The cumulative rate is at 6.19. Almost 280,000 have recovered. We're still in the 500s in the hospitalization. We were 528. We're 179 in the ICU units, and we're 101 that are on ventilators. I mean, it's surely better than where it was at the peak in this surge, but we've plateaued, haven't we? We just stopped. We didn't go way down. We just stopped. And there's no way to cut it, but more and more people are going to die. We've got 16 red counties now in West Virginia and 4 green counties. There's 24 outbreaks in our schools in 17 counties that have 404 people that are confirmed. Again, I ask for your prayers in every way. I mean, it's so sad. It's super sad at this time of year. Now because we have to, we got to go on. I'm going to just skip, just a second, and then I'll come back to more information about COVID. But our food banks in West Virginia, are so important. And they're especially important when it gets cold, and overwhelmingly important no matter what the weather when people are hungry. This is the second year that we've been able to donate these funds. These are funds to each of our West Virginia food banks, the Mountaineer Food Bank and the Facing Hunger Food Bank. They're both for $500,000 each. We absolutely do not want anybody in West Virginia going hungry. And our legislature has helped me step up and absolutely be able to give these funds. And I would say, let's remember we put a stake in the sand. No matter what it costs, we're going to take care of our people. No matter what it costs, we're going to try with all in us to not have West Virginians hungry. Honestly, if you believe in the good book in every way, should we ever turn our backs on people that are hungry? And so today we've got a couple of representatives with us. Cindy Kurthart is with us, and I think it's Brian George is with us, and today I've got a check for $500,000 to the Mountaineer Food Bank and a check for $500,000 to the Facing Hunger Food Bank, and tickled to death to be able to present these. And these are the great work of the governor's office, but absolutely the great work of the legislature as well. So this is good stuff. So if you guys could come on and talk a minute, that'd be great with me.
Good morning, Governor Justice, and on behalf of the 130,000 West Virginians that Facing Hunger Food Bank serves, arm in arm with the team you have assembled here, General Hoyer, we've partnered to do vaccines with the department. We've partnered to make sure that benefits are available. These resources help our pantries to be able to access all available food resources. We've purchased freezers and coolers and all kinds of infrastructure to support the long-term impact of this funding. So thank you so much. It is indeed a happy Thanksgiving for this team as well as all of those that we serve, and we wish the best and the same to you.
Do we have the other folks, Jordan?
Yes, Brianna, if you're with us, please speak.
Hi, yes. Thank you, Governor. And on behalf of everyone at the Mountaineer Food Bank, to you and your legislature for awarding us these funds. This funding will help provide food to support our programs and allow us to continue to provide food for those in need, especially during the holidays. So thank you again, Governor, for your continued support and helping meet the needs of those with food insecurity throughout our state. And also, we would like to extend an invite to you to visit our facility in Gassaway with your schedule permitting. Thank you.
Well, Brian, I'll come. I'd be honored to come, and to you and Sydney, thank y'all so much, Cindy. But you guys are doing great work, and God's work, that's for sure. Thank you so much. Okay, if I could give you another announcement, I think you'll really enjoy seeing this. But this Friday evening, the West Virginia Public Broadcasting is going to air a documentary on communities in schools, and you know how involved our First Lady Kathy is in communities in schools, and they have done phenomenal work. And I guess a camera crew followed them around and everything, and went to the schools and went with Kathy, and they've got an incredible story to tell. It is a truly great story. And I don't say this in any way because Kathy is doing this, but, because to be perfectly honest, I've said it over and over, we just fell out of the, just luck that we picked this, because it truly, and I mean this with all my soul, we've got so many great programs in West Virginia, and I've surely not seen and been involved in every one. But I am in and out of the schools in this state all the time. I have never, ever seen anything that works like this. And the great work that Communities in Schools is doing, it's phenomenal. It is absolutely fantastic. So watch that. It's going to be on this Friday at 6:30 p.m. and again, at 8:30 p.m. You need to watch this. This is really, really neat. It'll make you feel good and everything. And so I congratulate Kathy and all those that are working, really hard, to make things better for our kids, and Communities in Schools is making an impact. So thank y'all. I've got a birthday wish today to a beautiful 95-year-old and everything, but Georgia Caratonis is on every day, she says. She lives in Alma Creek, and she says that she has watched every single one of our briefings. So I'm sure that at times I've probably made you giggle, and at times I've probably made you cry. But absolutely, with all in me, I wish you the happiest birthday, and I want you around till way past we finish these briefings and everything. And again, you know, I just congratulate you on this great birthday, and I want you to have many more. She is fully vaccinated, and she has received her booster shot. We congratulate her on that and everything. But more than anything, God bless you in every way. And a happy birthday from myself and all of us. Thank you all so much. Thank you so much. I've got another announcement right now that today I'm honored to appoint Kathy Hess Krause, you know, to the West Virginia, you know, House of Delegates. And she is going to fill the seat of Delegate Josh Higginbotham, you know, who resigned, and the district covers parts of Jackson, Mason, and Putnam County. And Kathy, I know you'll do a great job. I could not be more proud. So take the reins and run with it, and we're really proud of you, girl. Thank you so much. Okay, I'm going to go back to our numbers and COVID stuff and everything. You know, I remind you over and over, if you're 65 years of age, and I mean, you do not want to play with this. That's all there is to it. It'll take your life. If you have any symptom of anything unusual that's going on, go get a test. And these antibodies, if you would happen to test positive, will save your life, and they'll do it very quickly. I remind you about wearing face coverings. If you're 65 and older or 50 and older and you've got health issues and you're going into a crowd of people indoors, you probably really ought to think really hard about wearing a mask. The FDA has approved all boosters to all Americans, 18 and above. You know, I don't know why they were dragging around about this, but finally they did it. And maybe we contributed toward that a little bit, because we were telling people, go get their test and everything, or go get their booster shot. And you really need to have a run on the bank to do that, because the bottom line, the whole thing, Dr. Marsh could not have said it any better. If you're 6 months out from your booster of Pfizer or Moderna, you don't have any immunities now, or very low. And if you're 2 months out on J&J, you're in the same boat. Now, it's going to get colder. You don't have any immunities. The Delta variant absolutely is multiples of times more infectious. What do you think the chances are? What do you think the chances of your decision to get fully vaccinated, and now, for whatever the reason may be hesitant or be just lagging about getting your booster shot? You can't do that. You just can't do that. You have got to put a run on the bank and absolutely get those booster shots. I asked for people to help me with the young kids over and over, whether it be parents or grandparents, help me there. All the information's up on our vaccine info line. You know, we've started and we're underway with the round 3, Do It for Baby Dogs sweepstakes and everything with our younger people from 5 to 18 years of age, you know, that have received 1 shot and everything, and children from 5 to 17 must have parental consent to do so and everything. But, you know, we absolutely are trying to incentivize those children and those parents or grandparents, whatever, to be able to make that really happen. You know, we're giving away 25 each week, 25 $10,000 education savings funds. We're giving away 100 each week, lifetime hunting and fishing license, and we're going to have some grand prizes beyond that. Okay, and all right, now as we keep on moving here, I tell you about all the free testing that we have in West Virginia going on. I always thank Frith and I always thank Walgreens for all the great stuff that they did or continue to do. We have 48.5 outbreaks in our long-term care facilities. We have 3 counties that we have outbreaks in our church community. We have 22 cases in our church community, but we have 3 outbreaks, and those are in the counties of Mineral, Nicholas, and Webster counties. Corrections is still continuing to do fabulous work. We have 63 inmates and 12 staff cases right now. I remind you about your flu shot. You can get your flu shot at the same time you get your COVID vaccine. I tell you over and over, if you're a renter or a landlord, we've got money waiting on you. If you'll just call and tell us of if this has put economic stress on you in any way, call and get in touch with us, and we'll be able to help some there. I remind our grand families about the $150 voucher, and and they've got all kinds of kids now in their care and everything, probably well over 19,000. I think it was 19,000 before, but now since we dropped the age to 5, it's probably expanded beyond that. But so nevertheless, if we can get them vaccinated, get you vaccinated, that's exactly what we need to be doing. Our briefing schedule next week is going to go to Tuesday and Thursday one more time. Our briefing schedule next week will go Tuesday, Thursday. We'll probably be moving and going back to 3 days a week soon, but next week we'll go Tuesday and Thursday. And the last thing I have, which is surely either one of the most important or the most important from the standpoint of we all have so much to be, very thankful for. Tomorrow's Thanksgiving. I ask you every way to take time, in your way, however, to express your gratitude and thanks, to whether it be to God above, your family, whomever it may be. Especially if you were to happen to run into a veteran or an active military person, please express your level of gratitude and thanks. Absolutely. For the health of all of us, it'll make you really feel good. I'm a real believer that the giver is always the winner. Always the winner. Not the receiver, the giver is always the one that wins. And if you're kind enough to give thanks, it will touch your soul. It literally will touch your soul. So tomorrow is a really big day. Take time to give thanks in every way you possibly can. That's all I've got right now.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just a couple of things before I get into COVID-specific items. Governor had a chance to do a lot of things with you and the administration, from economic development to responding to emergencies. And I just want to point out, in my opinion, one of the most significant things I think we have done collectively, and you and the legislature have done, is the support to our food banks. In addition to the facility that we added at Rock Branch that's made it more effective for our food banks and VOAD and others to serve those people in need. The feeding program we did for our children when school was out during the first surge of COVID, I think, are truly significant things that sometimes we greatly overlook. So I appreciate the work that's been done there. To our military families, in particular, who have loved ones deployed during this holiday, we keep you in our thoughts and prayers and appreciate the sacrifices that you make. Related to COVID specifically, unfortunately, our transmission rate continues to rise. It is at 1.04 today. It's continued to go up steadily over the past 10 days. We know from past experience and our data analytics that this is going to lead to additional challenges. As the governor pointed out, at the end of the first surge, we had almost a complete emptying of our hospital systems of COVID patients. That is not the case during this surge. We still have over 500, and a much greater percentage of those individuals are in the ICU and on ventilators. So when you combine that with the increased transmission rate, us going into the holiday season, us going into winter weather, and not having that complete emptying of the hospital systems, West Virginia, we are going to face a significant challenge during the holiday season and after that in the first couple months of January, based on the data that we see. And as the governor points out, the most effective way that we have to address that is to get vaccinated, and those who have been vaccinated to get a booster dose. While we know there are additional therapeutics coming out, there is a series of processes that individuals will need to go through to get those therapeutics so they don't become as effective as the vaccine, although we hope they will help us to some degree. So again, it's very important to get vaccination. And again, I go reinforce the governor's point. If we had this many people dying every day from a mine accident or disaster, or a series of highway accidents every day, or a series of fires occurring every day, we would be making monumental efforts to go forward to reduce that immediately. The only ability that we have right now to address the vaccination, to address the losses that we face from COVID, is vaccinations and boosters. So West Virginia, please take heart to that and go address this immediately. Thank you.
Thank you, sir. Secretary Bill Crouch and Dr. Anam Jad are also joining us today and are available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Stephen Adams with Ogden Newspapers.
Yeah, Stephen Adams with Ogden Newspapers here. And I don't mean to burst any bubbles, but you're all talking about the death numbers and where we're at right now and trying to raise the alarm bells. Well, we're almost a year into having the vaccine available since last December. We're 3 months away from the 2-year anniversary of being in a continual state of emergency for this. I checked the YouTube stats a moment ago. There were 406 people that were watching at one point. That's 0.02% of the state population. To pull away the curtain for a moment, there's 3 reporters on this briefing today, and it is, of course, the day before Thanksgiving. But still, it seems people have, despite your pleas and despite the numbers and despite the real issues, people have moved on. We might just be maybe by the end of the year getting those therapeutics you talked about, the Pfizer antiviral pill for one, which has a high effective rate. People are crying to high heaven for the FDA to start pushing out antigen tests and make those available over the counter in pharmacies, because if there's really no point in having an antiviral pill if you can't detect the virus quickly enough for that pill to do what it's supposed to do, which is, if you detect, the issues within 3 days, it's supposed to protect you from hospitalization and death. Do we need to pivot and try something else, try different messaging, try different tactics, focus on other issues, such as maybe focusing on resources for hospitals more? Because, looking at the 7-day average for vaccine numbers, it's pretty much stayed between 5,000 and 6,000 now for the last several days, and that doesn't look like that's changing anytime soon. In the younger populations, well, the fully vaccinated rate for people age 40 and down is just abysmal and doesn't look like it's picking up soon. So other than doing what we've now done on these briefings nearly every day, which is very repetitive, is there something else? This is for anyone who wants to answer it. How do we pivot to try to do something different that has more of a potential to get more people vaccinated and take this more seriously? Thank you.
Well, Stephen, let me answer. And anyone is I welcome anyone to jump in and have it, that would have another thought. But Stephen, while the viewership has surely dropped off, and from time to time, and it is the day before Thanksgiving, we could be missing some people there, but nevertheless, while the viewership's dropped off, at least our word continues to echo out through the media channels and everywhere if we come and we talk. I would say to you just this: anything, any idea, that we can hear, come up with, any idea that is presented to us would be considered. The other day, Mark Curtis, said, well, what about sending a robocall to everybody out on the boosters? Through all this, how many times have we pivoted and we've gone and we've looked at all kinds of new ways? But the net, Stephen, of the whole thing is just this. Now, let's just be really fair. When we started the do it for baby dog stuff, of all things, and I say it over and over, in this world today, we really need two things. We need to be able to smile and go forward because God has given you that. And the other thing that I believe with all in me is we need to understand we have got to reach out and love one another, period. That's all there is to it. And I've said over and over and over, if you'll just look at baby dog, her face, it'll make you smile. And she loves everybody. There's different marketing tools and everything. There's lots and lots of stuff in the tool shed. But really and truly, through that, from the very beginning of that till now, we are probably approaching, I don't know exactly the number, but I would bet that we are approaching 300,000 people that we've touched in West Virginia, somewhere close to probably 17% of the whole population that we have touched that have been vaccinated with at least one shot since we started. Now, from the other standpoint, Stephen, I don't know. I don't know what else to do. I am trying every single thing within me, everything. I'm out on the road. I'm going in front of all kinds of people. I absolutely am at school after school after school and encouraging, and we're winning. We're winning people over. That's all there is to it. 300,000. How many of them have we saved their life? And you mentioned, well, should we pivot and should we do something? I don't think we need to not always look at pivoting. We should always be fluid in what we do. But in all that, we don't want to drop the ball anywhere. We have surely, to God above, not dropped the ball with our hospitals. We have supported our hospitals beyond belief. And our hospitals are in so much better shape today than they were not many days ago. Now, with all of that, we continue to support our hospitals. We continue to support each and every one. And Stephen, I don't know what else to do other than come in front of you over and over, or go across this state, or absolutely use tools like robocalls or whatever the idea may be. All the broadcasters have been tremendous, to step up, and in being in the schools over and over and over. We're getting more. We're getting more. We're getting more. I wish to goodness that we could stop having to come in here and read 92 great West Virginians. It is absolutely terrible. It is terrible. But Stephen, we've won 300,000 people over. 300,000 people over. What would these numbers have been if we hadn't have done anything? What would the numbers have really truly been if what we'd have said was, well, let's just wait to see what happens, and let's staff up and really help our hospitals, because we're going to have an avalanche of people coming. All across this nation, everybody's tried in a lot of different ways. Stephen, I love you with all my soul, and you're a good, good man, and you're always fair, and that's what I absolutely love to death. Stephen, we've lost 4,817 West Virginians. You know where we're located and how elderly our state is and how sickly our state is. Stephen, this could have been the tsunami of tsunamis. And absolutely, there could have been so many deaths, it's unbelievable. West Virginians should be really proud. And if there's any other idea that you may have or whomever out there is listening may have, please just tell us. We'll try any and everything we possibly can to get more people across the finish line. We're hopeful, we're really hopeful that there's going to be a magical pill come along, and I've said it over and over, that all the vaccinations are doing is giving us time so the scientists and the doctors and the really smart people can figure it out. And so, Stephen, I just, I think what we're doing is working, and there's no question, there's nobody that could argue in any way that it hadn't worked, and is there a better mousetrap out there that somebody can come up with, or give us an idea on, and we'll pivot to it right immediately? Sure we will. Sure we will. But, I hear you and I understand, but Stephen, this right now, we're doing any and everything that I know we can possibly do.
All right, thank you, Stephen. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, everyone. Happy Thanksgiving to Governor Justice and the First Lady Kathy, and of course your kids Jill and Jay and Baby Dog and their families. And happy birthday to that young lady, 95 years young as well. Governor, I do have to ask a non-COVID related question because now this is a published report citing various public records. This was published through Next Star Media, our parent company, that Bluestone Coke, a company your family owns in Birmingham, Alabama. And I realize your son Jay is now president and CEO, and he's operating your companies. But there are two lawsuits filed by the Jefferson County Board of Health over air quality violations, it's alleging. The Department of Taxation and Business Licensing says Bluestone Coke does not even have a license to operate in Birmingham, Alabama. There is another lawsuit been enjoined by a group called GASP. It's an environmental organization, citing neighbors of the plant who's saying they're being made sick by the emissions and so forth. I realize the plant is now pausing production until April of 2022 and is promising to make repairs and upgrades in whatever it has to do to rectify these problems and these lawsuits. What can you say to assure the public, not only here in West Virginia, but in Alabama and any other states your companies operate, that you will do whatever, you'll move heaven and earth and do whatever has to be done to rectify problems that may crop up such as this and settle these lawsuits?
Well, Mark, first of all, I've got to say just this. I've never been to the plant. I've never seen the plant, so we got to understand that is absolutely, this is what I've been trying to tell everybody all along. My job is to be your governor. We have owned that plant for a good while. That plant had been bankrupt for all practical purposes, bankrupt 2 different times prior to us getting it. And with all of that and everything on top of that, it is very, 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 very old. I can tell you, Mark, without any doubt, all you've got to do is just follow around and just watch what goes on. Absolutely, with any and every obligation that we've ever had, we're going to fulfill. Absolutely, we're going to continue to do the right stuff all along. But just, when you really, and I don't have time to even think about, being able to tell you the whole story if I knew the whole story. And there's a tremendous amount of this that I don't have any idea about, But with all that, my family will do the right stuff. That's all there is to it. We'll do the right stuff. And I do know with that plant, 2 bankruptcies in a row before us and everything, and old plant, and you know, my job and my focus is these 92 people we lost. That's all there is to it right here. This is my job. My job is the health and well-being of this state. That's what I'm going to do. But my family wholeheartedly will always do the right stuff. We've done it and done it and done it and done it. How many businesses have we taken over? Perfect examples, the Greenbrier Hotel. How many businesses have we taken over, saved all the employment, and they're thriving and continuing right on? You know, you've got the situation right now with Bluestone in Wyoming and McDowell County. What was Bluestone in Wyoming and McDowell County doing 2 or 3 years ago? You were absolutely with the Russians. They were leaving town, leaving reclamation liabilities, leaving the union stiffed, you know, the retirement fund and everything with the union stiffed, leaving vendors, leaving taxes owed to McDowell County and Wyoming County and everything else. What did we do, Mark? What did we do? It's exactly what we do. All you've got to do is just follow it along, and you'll see over and over and over, you'll see our family at the end of the day cleaning a lot of messes up that a lot of people left. And you take a lot of flack because you are the governor and you're per se the billionaire and everything else, but you take a lot of flack along the way. But it doesn't matter to me. We're going to do the right stuff, and that's what our family does. And that's what we're going to continue to do. And I'm going to first and foremost look after these 92 people as best I possibly can in the state of West Virginia, and that's what we're doing.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Happy Thanksgiving, everyone. Tomorrow being the holiday and through the weekend, there's going to be a lot of families getting together with that empty chair that someone has been lost to COVID. And there's also empty chairs out there that are related to people that are estranged from their families due to substance use disorder. Governor, maybe you and then Secretary Crouch or Dr. Amjad address the other part of the issue about reaching out to those families that you know have experienced a loss due to COVID or some other situation this year. And the fact that, you know, maybe families need to close ranks and be maybe a little more understanding or a little bit more supportive of those that have gone down the road of substance use disorder. Happy Thanksgiving all. Thank you.
Secretary Crouch, if you want to add something to it, or Dr. Amjad, let me say this real quick, you know, before you get in there. I would tell you that, you know, Paul, if I read you correctly, and you know, that it's surely a time of year to be understanding. It's surely a time of year to be really, really thankful. It's surely a time of year to do exactly what I just said just a minute ago with Baby Doll. You know, if we could all make somebody smile, and we could all send a message that we love everybody, irregardless of any circumstance, wouldn't this be a better place? But Dr. Amjad or Bill, you know, if you've got something to add, please do.
Yes, Governor, thank you. And thank you, Paul. And thank you for remembering those folks. We've talked a lot about the SUD numbers and our overdose numbers going up after going down for a couple of years. This pandemic has just been brutal on everyone, but that particular population is still struggling. Losing those connections to their support groups and to their families and their friends over the past 18, 20 months has been difficult. And we're trying to help restore those links and get folks into treatment. So there are a lot of people out there right now who are struggling, and holidays many times are worse than other times with regard to losing those connections and not having those support groups. The governor and the legislature has done a tremendous job trying to tackle this problem. The governor's council on substance use has done some amazing things. They're doing 7 or 8 community groups, Zooms around the state to try to connect with folks in those communities that provide those supports and assist those individuals. So we're working hard to try to get the word out. I would just encourage everyone out there, anyone who knows anyone who is having difficulties with substance use disorder and who are using drugs, contact them. Please try to get them help, get them connected back with those support groups or their families. We have numbers on the DHHR dashboard all the time for folks, 24-hour numbers for people to call. So again, we want to get that support out there, and Paul, that's a great message right now when we have a lot of people hurting in the state. So thank you for that.
All right, thank you, Paul. Governor, I'll turn it back to you.
Okay, I've just got 2 or 3 things, and I'll go through them pretty quickly. But General Hoyer mentioned this, but if you'll go back and this was surely just a little bit of an oversight on my part, but because I just it seems like a long time ago, but in some ways it was a long time ago. But do you remember how the National Guard and others, whether they be their food banks or whomever it was, or maybe even private people and private businesses and everything, do you remember how they stepped up and they provided meals every single day? Do you remember that? Do you remember all the work that went on? Absolutely, to keep our kids fed and everything else that went on and everything. So to all the people that not only, that administered the food and everything, super, super special thanks. The only other thing I would close with, and this is probably not a high note to close with, is just this, the country of Germany today is contemplating shutting down because of the Delta variant and COVID. We all know that that there's all kinds of talk now about a 5th surge. We all know it's going to get cold. Now just think about it. Think about where we were. Why do we have to, my dad used to always say, son, if you're going to work a bulldozer really, really hard and you're driving that bulldozer, you're working yourself really hard, it's okay. It's okay if you happen to get in a mud hole or something like that and get that bulldozer stuck up. It's okay. But son, if you're operating D10 or D9 bulldozer and you get it hung up, for God's sakes a living, son, don't be silly enough. But he didn't say that. Don't be silly enough to go get one to pull it out and get them both hung up. Well, really and truly, if you'll just think about it, we know what it's been like to be shut down, don't we? And we know what it's been like to not have any vaccine and really be running through the streets and worried to death about what am I going to do? Am I going to make it long enough to get the vaccine? And then we did. Then we got the vaccine. And now we know what it's like to be able to go to football games and be able to enjoy this incredible fall season that we've had. We know what all that's like, don't we? But we also know what it was like when we had the bulldozer hung up. We know what it was like a year ago when stuff was shut down. We know what it was like with the bulldozer hung up. Now, for God's sakes a living, West Virginia, don't go get the second bulldozer and get it hung up too. There's a great message if you'll think about it. When it really boils right down to it, we've got an opportunity to stop this thing right now. Or we've got an opportunity to look back and have both bulldozers hung up. It's your choice. I love you with all my soul. Your choice. God bless. Have a great and wonderful, happy Thanksgiving. Thank y'all so much.